Hi there, I'm Dr. Jim Collins, and I'd like to tell you a little bit about myself. I used to take my mom to work at a nursing home for a long time. My mother never drove. She was a nursing assistant for 30 years in the same nursing home, the same floor, the same patients. The thing was, my father gave me a car and the keys, and he said, "Son, I'll give you this car as long as you drive your mother to work and pick her up every day." So that was the beginning of my journey in nursing homes and gerontology. Driving my mom to work, dropping her off, going to high school, and then afterwards I'd pick her up. But I got there right before her shift was done. So I'd hang out in the nursing home and I would think to myself, this is amazing, it's bizarre, it's interesting, and it's a little freaky. But I really fell in love with senior care at a very young age. And then I went to college. And believe it or not, I knew what I wanted to do all through college. I wanted to study gerontology. And my buddies would make fun of me and ask, "Are you going to make geritol? Is that what you're going to do with your career?" Nobody really knew about gerontology at the time, but I was studying it. I was trying to find every class that I could in psychology, sociology, biology, even in nutrition. So I specialized very early in gerontology. Now moving forward, I've spent over 3 decades researching, studying, presenting all over the United States. And my passion has not waned whatsoever. I'm a huge advocate for person-centered care. I believe it's your life. You deserve to live the way you want to live and die the way you want to die. I wrote an entire book on person-centered care. I also strongly believe in helping seniors who have Alzheimer's disease and dementia. So that's been another one of my passions. And besides the more clinical end of things, I absolutely love motivating healthcare professionals because it's a demanding job, it's a demanding career, and sometimes they don't get a lot of thanks. It's easy to become very stressed out and burned out in senior care. So I love teaching leadership, communication, team building, these types of topics. And I've been on the road for a long time, traveling to nursing homes, assisted livings, working with hospices, working with home health care agencies. I even go into hospitals and do lunch and learns and continuing education programs. Now, as a gerontologist, this might sound a little weird, but my new passions are in completely different areas. As you probably know, we have a severe opioid and heroin problem, an epidemic in the United States. So I've become very interested in studying and researching as much as I possibly can, and then getting out there and educating healthcare professionals on that particular topic. Another dark, they're all dark, I hate to tell you, but another dark topic that I've become intensely involved in over the last 2.5 years is human trafficking. And let me share something personal with you. My wife and I have a young daughter. She's 10. And that's about the time that a trafficker would try to find a beautiful little girl and take them away. So I started reading book after book, article after article, visiting websites on human trafficking 2 years ago or more. And I started to become a little depressed, to the point where if we went on vacation, my wife would demand that I do not bring any books on human trafficking on our vacation because I would be a downer. I worked through this sadness of the content I was reading, and then I started to become angry that this is a real thing, that there are more human slaves on the planet Earth than ever before, that women and young children are at the highest risk, actually, of being trafficked. Got through my anger, and then I told myself, now that I know all this information, I have to get out there and share it with people. So human trafficking is another one of my areas of specialty now. And the last, well, there are a couple more actually. Active shooter training, survival. That's another terrible trend in our country. Shooting in the workplace, shootings in schools, and shootings in healthcare facilities around the country. So I believe in being prepared and ready and training healthcare professionals about that topic. And then the last one I think I'll share with you is working with the LGBT community as they age. They may have very special needs, psychological needs, physical care needs, and where they live later in life is a very important thing to think about as well. So I'm on to a bunch of new topics, but I'm a gerontologist. Who knows what is next? But that's a little bit about me. I'm Dr. Jim Collins, and thank you for listening.